Hello, this is my case presentation for a client that I have at Sober Solutions. Just a quick background on Sober Solutions. It is a detox rehab for people who are suffering with a substance addiction. And so people will come in for about 4 to 7 days on the detox period, then afterwards go to 30, 60, 90 days residential at our facility. Just a quick background right there. Let's move forward here. Yes, so the individual's initials are KP. He is a 32-year-old male with Mexican heritage who was born and raised in California. Just like all clients at Sober Solutions, he does have an active addiction disorder, and his primary drugs of choice are methamphetamine and fentanyl, but he's also stated to experiment to use opioids, benzos, alcohol, weed as well. He does also have a co-occurring disorder, so he is diagnosed with a pretty severe case of schizophrenia, which means that he often, so he has the auditory hallucinations of hearing voices, and he's given some of them names and believes some of them are his cousins, family members, girlfriends, and also he does stated to have visual hallucinations. So sometimes he says he'll see things in the past. So more recently, he has been taking medication for that. He is taking an injectable second generation antipsychotic, which has been helping him decreasing these symptoms, but it doesn't go away completely. And so it does still report that he still hears voices despite being fully medicated, at least at this time, according to a psychiatrist. He does also, so in terms of his behavior cognitive stuff, he does have a bit of denial about his condition at times, where he states that he doesn't have it either nearly as bad or doesn't even have a mental health condition, that it's very normal for people to have this, often minimizing the symptoms that he has, again, saying that expecting everyone to have symptoms like his of hearing and seeing things that cannot be seen, cannot be explained. Impulse control, very common for people who have substance addiction. Put in situations, he finds himself saying yes, sometimes the wrong things, which includes using, it also kind of leaps into this boundaries area where he, depending on his relationship with people, he can sometimes just mix up with the wrong crowd, as he says it, and doesn't exactly know how it happens, but he knows it's because he talks to one particular person. Also, poor insight and sometimes even disinterest overall in the treatment that he has for his substance, because he's sometimes, again, in denial both about his mental health and in his substance addiction, where he'll say that he doesn't think it's nearly as bad, or that it doesn't affect anyone else, or that he doesn't even have one because he can stop any time, right? It wanders it wavers for a lot of people in this stage. Does also have some issues with self-esteem. In our conversations, he's explained that he does sometimes feel a lot of guilt and shame for what he's done in the past, and oftentimes it causes him to not seek out help or not think that others will want to help him. Sometimes he feels a lot of judgment towards himself and feelings of worthlessness at times. In terms of his upbringing and social environments, he grew up in the foster care system from a very young age, and unfortunately started using substances when he was, I think, somewhere in his mid-teens years. And in terms of people who he has support from, he only has one brother and one grandmother that he's more or less estranged from in the area, mostly due to both of them, him and his brother being addicts for some time. She doesn't always want to associate with them, so oftentimes they only have each other. In terms of the skills that are needed to really help in this area, understanding addiction and substance use disorders as a whole, plenty of biological influences, understanding that there is this the disease model of addiction, and that it does affect the brain in a very on a level that is hard to overcome sometimes, right? Because it is a chemical imbalance that all of a sudden the brain is causing to recognize these patterns faster. Plenty of psychological components for him. His mental health conditions, co-occurring disorder that he has, also makes it a little more difficult, but able to kind of use that and understand that as a whole a little better. Some crisis response and safety planning. Since he's been in Sober Solutions, he's been mostly okay, but I've also heard that in the past that he has had some instances where, responding to internal stimuli and having these issues and going to being put on holds, jail, and the sort. So something we're kind of being aware of as he put this right now. Evaluation, planning, goal setting. Again, we're documenting all these things. We're evaluating to see his progress, and that's kind of what's indicating to how well he's doing in our program and adjusting as needed. With his goal setting, asking him what he wants to accomplish and why he's here, and then helping him kind of match his own personal goals. Because he wants to, find a job and maybe go to back to school one day, and wants to be financially stable, and we can kind of match those things to where does your sobriety match into this? Where does being in a program to support you come into this? Able to have a lot of collaboration and team. I'm very honored to have a very good team that I work with techs and case managers and other therapists, and because again, it really is a team effort to achieve true recovery, and relying on a lot of people and knowing their strengths to let them operate the best they can really helps us all as a whole. This trauma-informed lens, understanding that his background and history does contain large amounts of trauma, and he's working on that, right? And realizing that that will impact the way he talks, the way he understands many principles in general, and taking that into care. And also focusing on his strengths, right? Even though, especially in the addiction world, people may neglect their strengths and what they're good at, but recognizing that yes, they are good at something. He is good at what he does, and him coming to treatment is very important in the first place. Evidence-based interventions. So I'm one of the therapists there, and I do use these techniques on the micro level: motivational interviewing, CBT, DBT, helping them understand, this is emotionally, are they getting stuck somewhere? Are there interesting thought patterns to detect, and help them kind of take in the emotions they feel and helping them kind of process them through. Facilitating the 12 steps, understanding that there is a lot to recovery, and it takes a lot of surrender, and allowing the process to occur, right? Some goal setting skills, teaching him coping skills. He goes to groups for education about his condition, as well as to help him process the different things through his recovery. On the meso level, everybody at the Sober Solutions goes to different community meetings. This could be AA, this could be NA, CMA, which is good. They get to meet other people and build this kind of support network for themselves. There's other treatment programs that they'll sometimes be connected to afterwards. There's some intensive outpatient programs, partial hospitalization programs, that kind of sort. So after they're done with our facility, they can have some follow-up somewhere to continue their recovery. And he is involved in a full service partnership in Orange County, which is helping him. It's primarily mental health, but they also have their own case managers, therapists, psychiatrists. They do a lot for him, and I've learned that it's very helpful to have kind of this level for someone of his severe need. And on the macro level, like I once said, I always look to my buddies, Pastor Phil Aguilar, the chief, who runs the Set Free Churches, to a way, essentially a church for people to come in who have addiction. They're very, very large scale like that. They've been able to hit the cities of gaining attention of, I know, the mayor of Anaheim, that kind of sense, and get people in kind of in this conversations about it. Mike Fiore, who's the CEO of Facing Fentanyl and also the Garage Church. He's also big in this sphere. He's a national speaker in many different states, and he's been inspiring a lot of people in their own recovery, and even speaking to policymakers and putting that forth. I know recently he was part of the bill, or pushed for the bill that made the raw materials for that are used to make fentanyl more expensive, which is very interesting to look at. And just some ethical diversity considerations, right? He does have a Mexican history, and so he might have these cultural values that I'm learning to be aware of, the way that his family roles, and of course, plenty of stigma around mental health and addiction in general for him. Plenty of legal system challenges and ethical dilemmas to kind of just understand. Does have some court involvement and letting him make his own choices. Again, where his addiction and schizophrenia will come together, and trying to understand, where does one stem the other, and then plenty of biases and disparities in treatment access that happens very commonly for many people kind of at a lower socioeconomic status, and hopefully helping him feel empowered and always advocating for him while ensuring that he's safe and everything's well planned out. And then in terms of assessing it, he has good physical well-being. He's volunteering around the facility. He is getting better, and that's nice. He participates a lot. I'm very proud of him. He has good follow-up. Thank you so much. Appreciate it.